Hi there, and good evening, and welcome to the Jim Bohannon Show from Westwood One Radio. We're at 1-866-50-JIMBO, 1-866-505-4626. Online, find us at jimbohannonshow.com. You can follow me on Twitter at Jimbo Talks. Child COVID cases are up. In fact, they now account for over 22% of weekly U.S. cases as the kids return to school. And let's talk with Patty Olinger about that. She's an infectious disease expert and executive director of GBAC, that's GBAC, the Global Biorisk Advisory Council. Good evening, Patty.
Good evening. How are you tonight, Jimbo?
Fine, thank you. I guess we should probably know in the beginning here more about the Global Biorisk Advisory Council. What is it?
Well, we are a division of ISSA, which is the International Sanitary Supply Association. It's the leading trade association for the cleaning industry. But our focus is on really prepare, respond, recover, and building resilience in facilities, communities, and service providers for things like a pandemic outbreak, anything that involves biological materials.
All right, now then, the figures that are up, of course, by now we have learned to ask a few questions as regards the pandemic. Of those new cases, over a fifth of those new cases now involve children. How sick do they get? Do they tend to get hospitalized, and do they tend to spread the disease? In particular, let us say to older faculty and administrative staff who might be more susceptible to COVID.
There's a study that was just recently published from the University of Nebraska Medical Center where they looked at basically data from this last year. I think there was over 300 different papers that were analyzed. And what we're finding is that, schools that implemented, we'll say, non-pharmaceutical interventions before they had the vaccine, and they put, in place masks, and they did other types of things, hand washing campaigns, social distancing, working, actually virtual school. We found that communities that did that actually had lower incident rates in the community of COVID. And so they are little super spreaders from that standpoint, as far as especially to individuals who have not been vaccinated and are not also following those procedures. So that is one thing that we do know. The other thing is that last year, when you think about it, we had some challenges with our testing. And because they knew, I think, there's a lot of different, say, anecdotal information out there that will state that kids weren't really tested that quickly because it was the more vulnerable populations that they were trying to test when they did have testing. Now we have many more resources available for testing, and we're seeing these numbers, and it may be more of a true number overall.
In terms of the importance of these various things here, let's start with the masks here. How important is it that these kids go back to school? They should be wearing their masks all the time, indoors, outdoors. You hear all kinds of things, and sometimes, regrettably, you hear contradictory things.
Oh, absolutely. We know that masks work. One of the things that is, frustrating, I think, for all of us is that we were hoping that by now we'd be over this and that we wouldn't have to worry about it. And what we're finding is that even with vaccination, you can become infected. It protects you against serious illness and death. We do know that. But that, in school settings, especially in those areas where the kids aren't eligible for vaccination yet, they can become infected. They can infect their teachers, other schoolmates, and then those individuals who become infected can take it home to their family members as well. So wearing the mask protects you, and it protects others in the event that you're infected as well.
How important is it to wear a certain type of mask? Now we've been hearing people getting picky about different types of masks. I think it goes without saying that we've all seen a number of people out there who have the mask over their mouth but not their nose. They don't quite get the point of it all. But we've heard some types of masks may not be satisfactory. Your garden variety disposable paper masks or your cloth masks. I mean, do we all have to wear a diver's helmet? I mean, what's going on?
I was going to say, yeah, I mean, there are obviously different types of even respirators that provide you different types of protection. We call those protection factors. The fact is that anything is better than nothing. And what we're finding is that, there are manufacturers out there that are actually doing some type of testing on their masks. It's called ASTM testing that shows that the filtration actually provides, a certain amount of filtration protection. And so looking at, a reputable manufacturer of a face covering is important. And but anything is better than nothing at all. And yes, wearing it over your nose and your mouth together is also critically important.
All right. What about testing? This is a procedure that, I mean, if I don't think that we are physically capable of testing every school kid in America, are we? I mean, it sounds like that would pretty much gum up not only the schools, but it would gum up the testing capabilities that we have.
Oh, that's a very good point. And the other part of it is it becomes, when you put some of these testing, I mean, don't get me wrong. I think that in the right situation, testing is appropriate and it's very important. But if you thought about having to test every child and teacher in the school system every day, financially, we could not afford that. And so it's, people need to think about what it is that they're going to be doing and when, and then what type of test that they're going to use. Is it going to be one of the quick tests, or is it going to be one that, they send it off and you get the results in 24 hours? So having a strategy in place before you need to make the decision is really important for school systems to consider.
1-866-50-JIMBO, 1-866-505-4626. We'd love your calls for Patty Olinger, an infectious disease expert and executive director of the Global Biorisk Advisory Council. Their website, by the way, is GBAC.ISSA.com, GBAC.ISSA.com. And I'll anticipate what some may tend to say. There's a strong viewpoint out there. This whole thing is overblown. Enough already. You've heard it all, and so address those people, if you would, before we go to the break.
Oh, absolutely. My son, actually, both of my sons are surgeons, and my youngest son is still in residency. He recently, they basically, at the hospital system that he's at, the residents, even the surgical residents, have to spend time in the COVID unit. And what they're finding is that the majority of the individuals who are in serious condition are all non-vaccinated. They really thought that way, that, this is overblown. And once they get into that unit, they start asking for different, they want to have the vaccine. They wish they would have worn masks. And it's very critically visible when you see we have the ability, the mitigation measures in place to be able to do it from our own behavior, to be able to mitigate this virus, but we have to bond together to get this done.
Is it possible or even likely that COVID-19 will wind up being like the flu? That is to say, yeah, it kills a lot of people, but we get used to it. Let's face it, the flu takes a toll every year, but we're used to it, just like car accidents. We're used to it. COVID, we weren't used to. Is it likely that we're going to get used to it, and every year we'll have to get, with our flu shot, a COVID shot, or maybe it'll even be in the same shot, to update us on the latest variations? We all know about the flu, of course, your garden variety flu, which I guess is the ancestors of what happened in 1918. Your garden variety flu changes a little bit every year, and every year they change the flu shot, and they hope they get it right. Is COVID going to be around in that kind of capacity in perpetuity?
We don't know yet, but I think that when I talk to some of my colleagues, that's one of the things that they're concerned about, is that it becomes basically what we would call endemic, and that just as you just described, just like the flu, every year it maybe we're dealing with a different what we call variant, and that we have to have our boosters once a year. We just don't know yet, and so unfortunately we're still in the wait and see.
I guess there are about 30,000 car deaths every year in this country, and no one is suggesting that we could even survive without vehicular traffic. How many people die of your garden variety flu every year that we sort of shrug off because it happens?
It depends upon the year. Every year is a little different, obviously, because of the different variants that are out there, and what our flu shot that we had, how well it is, prepared for the flu that we actually have circulating. It's anywhere between 30 and 80,000 deaths every
30
year.
and 80,000 every year. And again, I note the fact that, okay, we accept that. I mean, nobody gets squirrely about it. I just note that a lot of this is expectations, and the COVID hadn't entered our realm of expectations yet. So anyway.
No, I think that it's the other thing is that this may have, I guess maybe made us a little bit more aware of even the flu,
right?
And realizing that we didn't have many flu deaths last year, and it was because of a lot of the things that we were doing. Washing our hands, social distancing during the basically flu season, and cleaning and disinfecting surfaces, the high touch points. And so we protected a lot of people from dying from the flu this last year.
Let's talk to Wendy in coastal North Carolina. Hello, Wendy.
Hello, Mr. Bohannon. I'm so thankful you took my call, and I respect you and all of your guests. I'm a second caller. Talked to you a couple of years ago. After Florence. But anyway, real quick, I'll let you go. But I just wanted to encourage people to do their homework, get on websites. There are so many unanswered questions and so many unanswered, people are living in fear. I don't watch television. I listen to radio, reputable radio like you. And many other reputable stations. I try to get all my information. I have been defriended in many different ways because I haven't gotten the quote shot, only because I'm concerned. I'm not this crazy person who is an anti-vaxxer. I am 57 years old. I ride my bike every day. I'm very fortunate that I'm healthy and I live on the coast. I try to eat right. Don't want to talk too much here, but I just encourage people to do their homework. I don't watch mainstream media. I have friends and family they hate me. They just think they just hate me because I haven't gotten the shot, and that's okay.
Well, they shouldn't hate
my
you.
Life. Well, no, a lot of them hate me, Jim.
Well,
I
know.
Serious.
I don't doubt it. I'm simply saying that they should not. They should not hate you. I'd like our guest to respond. Wendy is one of those people who is not obviously among those who believe that you take the shot and they'll inject a computer chip into you that lets the government control your mind, or the vaccine is made from aborted fetal tissue. There are a lot of just utter nonsense that makes the rounds out there. Patty, Wendy in coastal North Carolina is not one of those people. She has concerns. She has questions. Any answers for people like Wendy?
Absolutely, yeah. I mean, Wendy, there's no doubt. I'm pro-vaccine, and I'm, especially with this COVID pandemic that we're experiencing right now. The pharmaceutical companies that have been out there, they really have. If you look at what they've done and the research that has been done, have done a tremendous amount of research. And if you think about how many people have received that vaccine and the very, very low rates of what they call adverse reactions, we're at a point now, especially now with the Pfizer being completely approved by the FDA. It's a very safe vaccine. Now, that being said, obviously you have the choice not to take it or not. But my recommendation to you would be understand what those other non-pharmaceutical interventions are, what they are to you. Wearing your mask, keeping your distance, washing your hands, and paying attention when you're into public spaces, especially public where there's a lot of people. Making sure that you are in control of your area. And if you think you might have been exposed, stay away from other people who may be very vulnerable, who can't get the vaccine but want to get it, and are, maybe immunocompromised.
I, too, am firmly in favor of people getting the vaccine. I've gotten every shot I can get, and will continue and get more as circumstances may so indicate. And I think we should keep in mind, nothing is perfect. The idea of holding anything, vaccines or anything else, to perfection. I mean, obviously, as we noted a moment ago, automobiles are not perfect. 30,000 or so people die every year from them in this country. We don't talk about banning automobiles. Perfection is a human goal. It is not attainable. And a lot of the risk factors, I gather, Patty Olinger, associated with this vaccine are in the category of your risk of getting eaten by a shark or your risk of getting hit by lightning.
Oh, absolutely. And from my medical friends, the doctors out there that I've talked to that actually have been working in some of these units, getting this virus and getting very ill, the serious illness, which we know the vaccine protects against.
And protects better than virtually any vaccines in history.
Yes.
I mean,
Absolutely.
what was the polio vaccine success rate? Far less. I don't know, 40, 60%? I'm not sure.
Yeah, absolutely right. And
these are all above 90%.
Right. I mean, all of them. And and what we're finding is that, seriously, that people who do have even a breakthrough, what they call infection, somebody who's had the vaccine but they get sick or they get infected, their illness is very mild compared to somebody who is non-vaccinated.
Patty Olinger, an infectious disease expert, executive director of the Global Biorisk Advisory Council, and we're looking at all of those cases of new cases of COVID, and almost a quarter of them now are among kids as they head back to school. And as we noted, not all of them will necessarily get sick, but they could be little typhoid Marys and spread it to all kinds of other people. Thomas in Arcata, California. Good evening.
Good evening, Jim. And to Patty, I had a question and a comment.
Okay.
I don't mind saying I've been living with HIV for the last 20 years.
Mm-hmm.
Should a person like that with underlying medical conditions consider the vaccine when you're already living with a current virus? And my comment was, a couple of weeks ago, I got really dizzy and I had all the symptoms of COVID. I called 911 when they picked me up, and I told the paramedic I wasn't vaccinated. She just blew up at me. I spent 5 hours at the hospital. They did x-rays on my chest, this and that, because I have a heart condition also. And by the end of the visit, they never even offered me the vaccine. Your thoughts, sir?
Yeah, well, that certainly seems inexplicable to me. Let's go over what Thomas has to say, Patty, starting out with a person who has been living with HIV for about 20 years, and I guess it has become now, for those who haven't kept up on HIV, once the huge death sentence has become more or less I guess in many cases, if you have access to the right medications, a chronic condition. It is manageable. Should a person like that get the shot? Now, I know one thing about the third boosters that are being talked about for the Moderna and Pfizer vaccines, and that is that while there's a waiting period, I think of into November for most people, but if you have a compromised immune system, and I would think that is a possibility with someone who has HIV, they're recommending you get the shots immediately. So give us your thoughts on question number one, Patty.
Absolutely. I mean, first of all, what I would always tell somebody is talk to your own personal physician, because they know your own medical history and what you're going through, and they can make the best recommendation from the standpoint of any vaccine. I don't care what it is or any type of medication that you're taking. So that would be my first thing. But what we're finding is that, just as what Jim has just said, people with compromised immune systems, you're the most vulnerable to this virus. And sometimes we have underlying conditions that we don't know about. And so I would highly recommend that you talk to your physician and really ask him what his recommendation for your specific situation, which only you and he would know.
And now let's take a look at the second thing he noted, in which he had developed what he says were symptoms of COVID. And they kept him at the hospital for 5 hours after he got a real lecture by someone in the ambulance. And at no time did they offer him the shot. That the way it sounds as he described it, that sounds like a rather incorrect way of handling this.
Yeah, I'm surprised that they didn't offer you the vaccine, but then again, I'm not sure. They may not have had it readily available to them. But absolutely, I mean, it's one of those things where, the next time, depending on your situation, if you have access to be able to go to one of the test clinics to go get the test to see if you do test positive for COVID. I would highly recommend that you talk to your physician.
Good luck to you, Thomas. Sandy is in central New York. Hello, Sandy.
Hello, thank you. I'm calling about N95 masks, and I bought a few from a local medical supply in central New York, and they don't have a respirator, and I keep hearing about they need a respirator. Now I called up, and they said they are 95% effective.
Are you saying that the N95 mask is supposed to come with a respirator?
Well, that's what I'm hearing. I
hadn't heard that.
No, so an N95 or an R95, the actual N95 is a respirator itself. And so it's a NIOSH approved, what they call respirator, and they call them 95% efficient. There's a lot of technical information in there. They're for occupationally related situations where you've done a risk assessment and you said this person needs to have an N95 for particulate, which a virus particle would be considered a particulate in this case. And so the thing is that there are a lot of manufacturers of N95. I'll be honest, some of them don't fit me very well. When I've gone through fit testing, some fit better. But an N95 is actually a respirator.
All right. To Jim in Rochester, Minnesota. Hello.
Yeah, Jimbo, I think just to say I stood in line in the mid to early 60s in a small little junior or elementary school in Rochester, Minnesota, and stood in line and got the shot for polio and all the other ones. It seems to have done it really well for me.
Well, it killed the polio pandemic. I mean, the people were dying right and left in this country, Jim. I remember when a kid in my neighborhood that we all knew and played with every day, we were forbidden to get within 100 feet of that house. I mean, the parents were going crazy.
Oh, I have a person that lived in Dakota, and they went to their aunt and uncle's house because of polio. Somebody was in the next door neighbor, so they actually stayed. Yeah. But I also got the COVID, and
you say you got the COVID. You got the disease, or you got the shot?
Yes, I did.
You got the disease.
I did not get the. I got the disease. Right around Halloween last year.
Okay, all right.
Then I went a while to kind of get an idea as far as getting to, but I did get the first one of the 2 shots, and I'm going to.
This was what, after you had already been diagnosed with COVID?
Yeah, after I'd already had it, I kind of was waiting for a little more information from places and from people.
Which shot did you get, if I might ask? Pfizer, Moderna, or Johnson & Johnson?
I believe the Moderna.
Moderna. So a 2-shot. You got the first of the 2 shots, but you did not, I take it, get the second Moderna shot. Is that correct?
Yes, I will be getting that in the next couple of days. I've just been in. But I also, like I say, we were talking about masks, and I do believe in my mind, the biggest thing that the mask does, it keeps people from touching a surface and bringing that stuff to their mouth, into their eyes, into their nose.
Well,
that's the biggest thing.
Our guest can tell you that's one thing, I'm sure, but our guest can tell you about the biggest thing. And any other advice for Jim in Rochester, Patty Olinger?
Oh, absolutely. Well, he is absolutely right. It keeps us from touching our nose and our mouth after we've touched a contaminated surface. But it does provide that layer. I talk about layers of protection, and that it's not just one magic thing that's going to protect us. It's a layered effect, and it does provide you being say exposed to droplets or aerosols, that somebody sneezed, as well as in the event that you maybe get the virus and you didn't realize it, and sneeze, or which is a terrible thing to do when you have a mask on, believe me, and expose somebody else.
All right. More to come. 1-866-50-JIMBO. More calls. We'll be back with Patty Olinger of the Global Biorisk Advisory Council. More and more new COVID cases involve children. Back in a moment. Welcome back to the Jim Bohannon Show, 1-866-50-JIMBO, 1-866-505-4626. Patty Olinger is our guest, infectious disease expert. Here is Michael in Virginia Beach, Virginia. Good evening.
Good evening, Jim. Good evening, Patty. Patty, I've heard 3 different networks do a montage of Dr. Anthony Fauci contradicting himself repeatedly with regard to masking. And I know that your organization has a very impressive sounding name, but I'm concerned because I've heard many virologists who complain about how the NIH and the CDC have handled this whole pandemic from the beginning, especially with regard to the fact that Dr. Anthony Fauci now stands accused of having lied to Congress about funding this killer pandemic in the first place.
Well, okay, let's get into all of those things. First of all, any Fauci ties to that Wuhan lab were obviously unfortunate. I have yet to hear a single good reason why we should have been sending one penny in the direction of any research activity in China, especially at that lab. That's number one. Second, Fauci's messaging. In fact, the entire government messaging has been terrible. It seems to me, Patty Olinger, that we have had a severe case here, a pandemic, if you will, of people blurting before they knew exactly what the situation was. Public trust is not something to be taken for granted, and I think the messaging on this whole subject has been abysmal, and I'd like your thoughts.
I think that the other thing is that, and having been in this situation when I was with the Ebola team at Emory, is that, they will say something, and I don't think that sometimes, like you said, they say it before they think. Or the other problem that we ran into is that we were learning as we were running. And I don't think that the general public really was used to seeing science in action from that standpoint, where you would have a theory one day and it would be completely changed the next. And they didn't do a very good job of explaining that. And so when they would flip their decisions, even within the same day sometimes, it really degraded public trust. Yeah. And it was a very sad situation from that standpoint.
It was, and they should keep in mind that most of the public has never had anything in the way of science courses beyond the bare minimum necessary to graduate from high school. Kurt in Grass Valley, California, good evening.
Good evening, Jim. Well, first of all, I want to say I just love your show. It's the most credible show on radio, TV. Patty, that last caller just expressed my feelings about government credibility, radio, whatever, all of it. It's gone. But you, Patty, For some reason, you have more credibility than me, just the way you're answering questions. You're very believable. I had a question about, my understanding was the federal government was passing out money to hospitals, clinics, whatever, that treated, in the early days anyway, I don't know now, I don't know then, but was passing out money to anybody that treated COVID patients and they died. I have a very good friend, he's a retired fireman, who has a young man, a buddy of his, who died on the freeway on a motorcycle accident. He saw his death certificate, said cause of death, COVID.
All right, we've heard stories like that, and in the time that's allowed here left, I want our guests to respond. We've heard stories like what Kurt is saying, that if somebody is diagnosed with COVID, they walk out of the hospital or the doctor's office and they're hit by a bus. It's called a COVID death. Is it true that I'm sure there may have been some such cases. Is that a significant factor? Are there financial incentives for hospitals and doctors' offices and others who treat COVID to, shall we say, hype the COVID numbers?
We've all heard that, and I don't know the real answer to that question, but we all heard those stories, and I think that the stories that I heard were that occasionally, like you said, they had COVID, they died of something else, and it would say on the death certificate COVID related. I don't know that that's fact, but we've all heard those stories.
Fair enough. Brian in Ozark, Missouri. Hello.
Hello, Jim. I just want to clear something up. You had a caller or two callers ago that were saying that, an N95 is a respirator.
Our guest said, the caller was saying that she was told that you had to get a respirator with the M95. Our guest said that an M95 comes with a respirator.
Well, N95...
Go ahead, Patty, and then back to Brian.
Yeah, no, an N95 is actually a respirator.
Okay, so now then, Brian.
Okay, now can I answer? A respirator is a rubber mask that you put on your face that has a filter on either side. It goes over your ears and around your neck and over your head.
No, that's a type of respirator. Those are called either half-face respirators or full-face respirators, where they have the rubber gaskets and you actually put cartridges on each side. Mm-hmm. You see those also for like chemical cartridges. But a N95, a true N95, NIOSH-approved N95 is a respirator.
But not that type of respirator.
But not the rubber face mask that you put cartridges in.
Yeah. Okay, Brian?
There's a difference between the two. A rubber... Yeah. When I was in the Army...
Okay, well, let's let our guest explain the difference. Patty?
So the difference between the two, the rubber that goes around your face, actually a lot of the N95s will have a little bit of a rubber seal if you look at certain manufacturers that go on there too. What you probably don't realize is I was actually for about 30 years, I've been in charge of environmental health and safety programs, and all the industrial hygienists would report into me. And so from a respirator standpoint, you have to be fit tested. Even those N95s in an occupational setting, you're supposed to be fit tested so that you get the right fit. But you have to determine what the use is. When you get into those fast face masks, you can have a HEPA filter on those so that they will protect you from COVID. But you can also get cartridges that you can put in those, many of them, for different types of chemicals, volatile organic compounds, formaldehyde, multiple different. And then you can go to something called the powered air purifying respirator. Those were my favorite, where they would filter and have air that blew over your face, and even to a supplied air.
All right, very good. More to come. Back in a moment. Welcome back to the Jim Bohannon Show, 1-866-50-JIMBO, as we talk with infectious disease expert Patty Olinger. And noted that as kids go back to school, almost a quarter of weekly U.S. cases, new cases of COVID, involve kids. Let's talk to Karen in LeGrand, Oregon. Hello.
Hi, Jimbo. Yeah, I was wondering about the kids because I think all along they've probably been getting COVID that, like she was saying earlier, I think that they just hadn't been tested. How many kids really have been getting it bad enough to where they go into the hospital? I mean, because there's other things that can happen to the kids. Wearing the masks can have a bad effect on children too.
Well, let's talk about both of those things. First of all, any bad effects of wearing masks, number one. Number two. But number one, the percentage of kids that get really sick and get hospitalized. My basic understanding, not a detailed understanding, Patty Olinger, is that very few children get that sick.
Compared to the adults, that's true. But what we're seeing with the Delta variant is that more children are becoming ill and needing hospitalization for some reasons. Okay. And so
are these the Delta variant?
A lot of them are this Delta variant is really
right.
Infecting, having more problems with kids.
Right. And as regards problems, the kids have a problem wearing masks. Are there bad things that happen to any people, kids or grown-ups, who wear masks?
Well, it's one of those things where you got to remember. I mean, I think this is I want to say an urban myth, maybe a reason why we don't want to wear it. You've got populations out there that wear masks every single day for their jobs. Think about a surgeon who's in there all the time, and we've never seen some of these things like what they're talking about, bronchitis. And I mean, what you don't want to do is wear dirty masks. Nobody does. And I think that's the thing, is that we need to, pay attention to if it needs to be washed, to wash it frequently, and also or wear disposable masks.
Thanks to our guest, Patty Olinger, infectious disease expert, executive director of the Global Biorisk Advisory Council, online at gbac.issa.com.